Good afternoon. I will be doing a ankle and lower leg exam on myself as I do not have a partner today. For the first part of the exam, I will be doing a squeeze test. So it's better to do it laying flat on your stomach, but I do not have a partner. So first you have to squeeze the calf and then see if the Achilles is ruptured. It would be better to be relaxed as possible. Next, I will palpate the dorsal pedis artery, which is on the top of the ankle. All you have to do is press here, and then you should feel a heartbeat. Next is to palpate the posterior tibial artery, which is behind the ankle. It'll be the exact same test as here. You just feel a slight heartbeat. Next is to perform a capillary refill test. You should squeeze the toe and see if blood refills. If blood takes too long to come back, that means something's probably blocking it. It could be an ankle sprain, it could be an Achilles tendon rupture, but you should get that checked out. Next is the active range of motion for plantar flexion. All you have to do is put your foot downwards. So if you go into a trainer's office and you think you have an ankle sprain, if you push your ankle downwards and it hurts, that is a great possibility. Next is to test the active range of motion of the dorsiflexion. You take the top of your foot and push it upwards. For the active range of motion inversion, all you have to do is put your foot inwards, and for eversion, outwards. Next is the manual muscle test for dorsiflexion. For this part, it's better with a partner because you have to push against your partner. But here's how I would do it. I would push your foot upwards for dorsiflexion, push your foot downwards for plantar flexion, push your foot inwards for inversion, push your foot outwards for eversion. A different test for plantar flexion would be to stand on one foot. It doesn't matter which one, and then you have to go on your toes and down, up and down. I can switch feet as well, up and down, up and down. Next would be passive range of motion. Here it's more like you have to push up against your partner, but not as hard. It'll be the exact same as the other test. Your partner will push your foot upward for plantar flexion, push your foot downward for dorsiflexion, push your foot inward for inversion, and push your foot outward for eversion. Next, we're going to move up to the knee. Here, it will be best to have a bent knee for the anterior drawer test. It's to see if there's any swelling, any tearing. If any of your joints are moving when you're pushing it, you could have a possible ACL tear. For the inversion tilt stress test, your partner would hold your ankle and you have to try to force it inwards. They want to see how much strength your ankle actually has. It'll be the exact same thing for eversion as well. For the external cleaver test, all that is to rotate your ankle. It's also to see how much you can move your ankle. If it's too tight, you may need to go to rehab. For the distal tibial fibular joint play, squeeze the ankle on the side and see if there's any joints that are moving around. For stress fractures, for severe ankle sprains, it tends to move around right about here.